Good afternoon, ladies and gentlemen. As Chair of the National Forum for Health and Wellbeing, it is my pleasure to welcome you to this, our very first virtual seminar, which focuses on some of the most urgent mental health issues facing us today, those involved in coping with COVID-19. Welcome too to our distinguished team of contributors. They have so kindly given of their time and expert knowledge to help us understand the negative effects of the pandemic on mental health and what can be done to mitigate them. It is becoming increasingly clear that pandemic's effect, often subtle and long-lasting, reach out to touch many more those who are unfortunate enough to contract the infection. The mental health issues associated directly with the infections are of great concern, but so too to those which inevitably follow experiences of lockdown, self-isolation, shielding, bereavement, loss of income, etc. These factors are having a profound effect on mental health of individuals, families, friends, and whole communities. An exploration of these factors and how we can more effectively respond to them is at the heart of today's seminar. The NFHW has arranged a meeting this afternoon in a passionate belief that public engagement activities can promote mental health literacy, reduce the negative perceptions of mental ill health, and promote strategies for coping. I thank you once again for joining us today and wish you a thought-provoking afternoon. Keep safe and be positive.
My name is Professor Cathy Jackson, and I'm the Executive Dean of the Faculty of Clinical and Biomedical Sciences within UCLan. The faculty has the School of Medicine, Dentistry, Pharmacy and Biomedical Sciences, and we are delighted to be supporting this Health Mela yet again. I think the work the Health Mela has done in helping people to learn more about their own health and how to stay healthy is invaluable. And this year, particularly when the focus is on mental health, it is perhaps very pertinent to the very challenging year that we've all had. I think mental health this year, more than ever, is going to be vital for us all to learn about how to look after our own mental health, how to recognise signs in others when perhaps their mental health isn't what it might be, and what to do about it. So, once again, we are delighted to support this Health Mela. I wish it the very best of luck, and I hope that everybody enjoys everything that it has to offer.
And I welcome all the distinguished speakers and the attendees to this unique public engagement seminar on mental health. I was astonished to know that nearly 800 million people are affected by mental health problems in the world, and 1 in 6 working adults in the UK have symptoms associated with mental health illness. In fact, it is astonishing to know that 1 in 4 people in UK suffer from mental health problems at some time. Mental ill health is responsible for 72 million working days lost and costs nearly £35 billion each year in the UK. Mental ill health is second largest disease burden, and it has become worse with pandemic due to isolation, business and job loss, bereavement, as well as inability to communicate to people who they can meet and trust. The statistics show that rising mental health burden, including the depression, anxiety, post-traumatic disorder, and many other health problems, are rising. It's time to recognize that mental health illnesses are common, long-lasting, and more impactful than many other health conditions that are visible. Mental health problems result from or result into the problems in thinking, feeling, mood, and emotions. If we can help people thinking and feeling better through the family and the community support, many people will recover and may not need the medical treatment. The literature shows that 70 to 75% diagnosable mental health illnesses receive no treatment. The waiting list for mental ill health is very long. Yoga, meditation, art therapy, dance therapy, music therapy, and many other non conventional ways have been found and proven to help the healing of mental illness. Let us work together to make the society more powerful and reduce the mental health problems. Can I welcome Professor Dame Sue Bailey, our keynote speaker, who is past president of the Royal College of Psychiatrists, immediate past chair of the Academy of Royal Medical Colleges, and also non-executive director of the Manchester University NHS Foundation Trust. Welcome, Dame Sue Bailey.
Well, a very warm welcome, everybody, to this Health Mellow. My name's Sue Bailey. I'm a child psychiatrist by background, and I also am the chair for the Centre for Mental Health, which brings evidence-based policy into practice. Please look at their Equally Well website to learn more about bringing together physical and mental health. I'm part of an online mental health platform, Keynote, where you can go to look at ideas and help and support. And I'm interested through my role at Health Education England in how we can deliver a workforce better and differently. Let me first start by congratulating Ramesh and the team for continuing these health mellows through this rather surreal period of COVID. COVID, where we all know it's shown the stark reality of the inequalities gap and unfortunately the widening mental health inequalities gap, which means more people with mental health problems living in poverty and frankly desperation. Uncomfortable truths that abuse and discrimination are never more than a socially distanced conversation away, but we must help those people get the support we need. And for many, as I reach out to you today, I know that this will involve some of you, the painful reality of family loss or bereavement, or being at the front line of looking after those who unfortunately do not survive. So, some questions that we can all address. How can we support communities and protect the mental health, particularly of young adults who've never been in work, who've been trained to go in a job, who've just started it, but for the future that work may no longer be there for them? You have skills and talents, and we want those skills and talents, and we want you to bring them into the mental health workforce. It's a brilliant career and profession, so please, please come and join us. It's good for us, it's good for those we serve, and it will be good for you. With the reality of long COVID, which impacts on both mind and body, can we work better with everyone, and particularly those who support the physical health needs of people with mental health problems? Because we know that these are poorly understood. We know that people with mental health problems die some 20 years sooner than those without mental health problems, and the same applies for those with learning disability and autism. But we equally know that those with long-term physical health conditions experience mental health problems which impact on the quality of their life. So surely it is time to close the mind-body gap and to join the Equally Well campaign, which you can find on the Centre's website. How can we push together for a long-term plan, now we have a white paper coming our way, to bring together social care and health care? And we know that has to start, if it's going to work, from local communities, from individuals saying and working out what they need to do in their community to think about the we, not the I, to consider those with mental health problems and to offer timely help in a respectful and valued way. It's been a difficult time for everybody, but I think it's been particularly tough for children, and it's good news that they're able to return to school in March, hopefully. But they have missed so much of the social context of life, which is so critical to their mental health and well-being. So I hope here today we can together energise ourselves to really look and think about what children need for the future, so that we can be part of a movement that ensures that the children of today will be the parents of 2035 who have mental health and well-being, who can be good, caring, supportive parents themselves to their own children, who can learn to enjoy their leisure and who can work productively and give to community. That has to be our wish for the future. But for 2021, I hope and I believe there will be more hope this year, and that we will march through this pandemic, that there will be some joy, and if there is some joy in your life, you have to take that whilst being respectful and appreciating the difficult time many are having. But there has to be less fear. And to lessen that fear, I want to talk about physical health for a second, and that is to reach out to you all and say, really, really do everything you can to support everyone in the community to have their vaccination. It's the right thing for them, it's the right thing for their family, their work colleagues, and it's the right thing for local communities. So to finish, what will be the equivalent of the mental health vaccination? And I believe that will be by us all coming together, by sharing the ideas you're going to talk about and discuss this afternoon, and having a belief in the future that we can improve the mental health of all people. We can stop and prevent more people from developing mental illness, and that we can do this together. So, in the words of the Force, may the Force be with you, and I hope we have a successful meeting, and thank you for listening to me.
Hello, my name's Rob Webster. I'm the lead Chief Executive for the West Yorkshire and Harrogate Health and Care Partnership. We're a partnership of councils, the NHS, communities and third sector organisations. I'm also a Chief Executive of a large mental health, learning disabilities and community provider. The pandemic has seen a significant impact on all of our lives, and epidemiologists and health planners look at the impact in 4 different ways. Firstly, we know that people who are directly affected by COVID need support and treatment, and we see the news about that every day, with pictures of people in critical care beds, on ventilators, and some of them very poorly. The second group of people are those who find it more difficult to access treatment because beds are full of people with coronavirus, so people with cancer, people who might need a knee replacement or other elective procedures. The third group are those with ongoing conditions who might have them exacerbated by coronavirus or by the impact of not being able to access care, people with asthma or things like COPD, diabetes and so on. And then the fourth group, the fourth impact of COVID is on people's mental health. And what the planners say is you can see a very short-term big impact on that group of people with COVID. You can see a bit of an impact on people who have not been able to access care with other conditions, a medium to longer term impact on those people with chronic conditions who might get sicker, and then a longer term higher impact on people's mental health and well-being. Now, we're also in a context where coronavirus has impacted upon the economy, and we don't have much evidence and research of the impact of pandemics on people's mental health. We haven't been through a pandemic like this for a century or more, so evidence of that is limited, but we do have evidence on what happens to people's mental well-being during a recession. And recessions tend to have a significant impact upon people's mental well-being and lead to more suicides. So what does this tell us? It tells us that we really have to pay attention to the mental well-being of people in our communities and in our organisations during the pandemic. And this is played out a little in the evidence and the facts and research that have emerged over the last year. Work done in Leeds and across West Yorkshire shows that people with certain conditions who are shielding, who have to live more restricted lives than everybody else because they are clinically extremely vulnerable, they say that their mood, 50 to 60% of them say their mood has been affected by COVID and the restrictions. If you look at other surveys done in West Yorkshire, they show a third of people who are shielding, so their mental well-being, not just their mood, but their mental well-being has been affected by COVID. And these sorts of figures we really must pay some attention to if we're going to focus on the things that really matter to local people. At the same time, there's been a lot of chatter, and you might have seen some of this on social media, that the number of suicides has increased and that there's been a significant surge in people who die by suicide. Now, there is a national inquiry into homicide and suicide run by Manchester University, which has been monitoring this situation. And what they say is that there's no evidence of a significant increase in suicides. There is, however, an increase in the number of people who are self-harming. And for those who are specialists in mental health, you'll know that the two aren't always directly linked. People who self-harm may not be suicidal. There are other issues that they are facing which is causing that sort of behaviour. So it's important to recognise that we've got this understanding that pandemics, the fourth element of a pandemic is the impact upon mental well-being. We've got some evidence that recessions cause an impact upon mental well-being and an increase in suicides. We've got evidence that's emerging that people's mood and mental health is being impacted by COVID, and we know that despite chatter, suicides haven't actually gone up, but self-harm and mental well-being has been affected. So as a partnership and as an organisation, we've been doing a lot to support people during this period. Some of those things are about what just keeps us well in our daily lives. Our mental well-being and resilience is supported by our physical health, by our environment, by the occupations we're able to do, whether that's cooking, kicking a football around, or a job. So we've been working with third sector organisations, charities, and through our own teams to make sure that people are able to do things that keep them well. So for example, in my trust, we run 4 recovery colleges that put courses on for people affected by mental illness or their mental well-being is affected. They've continued online to keep connecting people to make sure they get peer support. Our third sector organisations working in a big campaign that we've got called Looking Out for Our Neighbours. You might have seen that on social media, hashtag Our Neighbours. They've been looking at how do we make sure that people provide support for each other in their neighbourhoods, and in doing so know what help is available. And there's a significant amount of information that we've pulled together in each neighbourhood, and you can access this on our website, that shows what help is available should you need some support. So we've been doing a lot of work through the Our Neighbours campaign and through that kind of social support to make sure that people can remain well. Now, we know that this is a tough time, and some people who've never faced mental illness can become very ill. About 1 in 6 people who are admitted to a mental health bed have not been in touch with services before. And often people find it difficult to navigate the services that we provide. Sometimes we make them too complicated. So we've put in place a 24-hour helpline, a 24-hour crisis line that people can ring free to get advice and support, and if necessary, signposted or referred into other services. That service is used every day. and we're providing support to people every day. I must really stress that our services have not closed. Our services remain open. They might be being delivered differently, but we have services. So the first thing we've done then is put in place a 24-hour, 7-day-a-week crisis helpline. We've also put some targeted support in for different groups. We know men are more vulnerable to suicide, for example, and with State of Mind Sport, we pull together something called Great Minds, which meets every week with sports stars to look at how do you maintain your mental well-being and resilience. And over a period of weeks, you get support in that. We've also worked with groups like Andy's Man Club and various other charities to make sure that they're supported in this space too, because unfortunately suicide is still the biggest killer of young men in West Yorkshire. Now, alongside this, we've looked at services for people who have been affected by suicide. Suicide post-vention services is the jargon, because you're more at risk of dying by suicide if you've been affected by a friend or a family member dying in that way. So we've got support services that we've put in place to make sure that people can get help. Now at this time, every day we're faced with a number that's read out on the news of how many deaths there have been. You know, some days it's been over 1,000. And behind every one of those deaths is a story and a family. And a story and families who can't grieve in the same ways. Restrictions on funerals, restrictions at the end of life mean that the grieving process for many people is different and more difficult. So we put a free bereavement support service in place for people, so that if you're finding it difficult to deal with your grief, then you can get help. Obviously, alongside all of these services that have been put in place during the COVID period, we've, as I've said, got our mainstream services which are all open. To help understand those and to navigate them, we've been the first trust in the country to produce a Choose Well guide for mental well-being, and it describes, if you just feeling a bit off, what we might be able to offer. If you're worried about your mental well-being, what your GP might offer. If you need some support through psychological therapy, self-referring, or getting a referral into and improving access to psychological therapy service is available across all of our places. If you need more support than that and you need a community mental health team, that's available. If you need a psychiatrist involved in a more enhanced way, that's available. If you're in crisis in the middle of the night, there are teams who will support you. And if you need to be in a bed, there are beds for you. So there's a range of services that we've got which are available to people now and will always be available. The services that we've put in place for mums, for example, expectant mums and new mums who are particularly vulnerable around their mental well-being at times, are now delivering results which the people who use them say have helped transform their lives and the lives of their babies and children. So I think if I had a message for everybody watching this, I would say your mental well-being is affected by your physical well-being, which affects your physical well-being is affected by your mental well-being, because you're a person, and your mental, physical and social needs all come together sometimes in ways that we're here to meet. So we are here, we do have services for you, and you can access them, and you can also help by volunteering or helping others. So thank you for listening to what I've got to say. Throughout the last year, I think I've been really struck by what we've seen in our communities, which is an outbreak of altruism. People being kind, people being compassionate, people being caring, and people have supported one another. And I hope that continues, because that's at the root of our sense of place, our sense of community, and our mental health. Thanks a lot.
Good afternoon, everyone. My name is Dr. Nav Alwalia. I'm a consultant psychiatrist, and I'm the medical director of the Rotherham, Doncaster and Southampton NHS Foundation Trust, called RDASH. It's a mental health and community trust in the north of England. I said good afternoon, but I'd also like to say Sat Sri Akal, Namaste, Assalamu Alaikum, Wapnin if you're from the West Indies, Guten Tag from Germany, Bonjour, Buenas tardes, and many other languages under the sun that I wish I could speak. But it's my way of saying to you that you are an international audience, and all of us, regardless of our cultural, religious, or geographical backgrounds, have something that we can contribute to this country's health service, but also something that I think we should reflect upon in terms of the effect that COVID-19 may have had on our mental health. I've been asked to speak to you about this by my friend Dr. Rajiv Gupta. Over the next 5 or 10 minutes, I'm going to be splitting the small talk that I'm going to give into the indirect effects of COVID, the direct effects, and also the effects on what we call long COVID. I'm going to start with the indirect ones, because actually, although it's often the one that perhaps gets least attention, in my opinion, it's the most important. So we cannot fail to have noted the effect on our everyday lives of COVID, and that's why it can affect our mental health. For example, many people are now worried about their jobs. Many people are worried about going to work in case they contract the illness. But also some people, because they've been either shielding or working from home, are missing out on what I call the everyday interaction of work life. Meeting people at the kitchen to have a cup of tea, in offices, in meetings. We are social animals, and we rely upon these interactions to keep us alive, feeling that we are grounded, feeling that we have a purpose. In other words, work is not just about working. It's about our human interactions. And that's often perhaps not given the right level of attention. We've also got people who are genuinely frightened for themselves. This is not because necessarily they are paranoid or psychotic or deranged in any way. It's simply that when you go through a pandemic, it affects people in ways they perhaps wouldn't have understood beforehand. Let me give you some examples. Why do you think people were filling their trolleys with toilet rolls, right up to the ceiling, 400 toilet rolls, buying 28 packets of beans, 16 packets of sugar and flour? Why were they doing that? Is that because they were psychiatrically unwell? No. They were doing that because it's man's response to what I call a pandemic or a fright. We automatically want to feel safe and to do something to feel safe. So get lots of food and salt and sugar, etc. A pandemic also makes us worry about infection and dirt. And one way of coping is by overcompensating and buying washing products and toilet paper. Now, some of those poor individuals have probably built their houses out of toilet roll, but they weren't doing it because they were deranged. They were doing it because that's the psychology of a pandemic. There are many doctors who ordinarily are quite robust individuals, but at the start of the pandemic became frightened, were speaking about their worries about the future, writing wills, and fearing for the safety of their family. Were those weak individuals? Were they somehow lacking in moral fibre or courage? Absolutely not. That is the effect of a pandemic, and it makes people question things they would ordinarily not even worry about. That's the indirect effect of COVID, often perhaps downplayed, really, really significant. The next bit is about the sort of direct effects of COVID. And that can affect us in many ways if we become unwell. So let me give you some examples. If you get COVID now, especially if you're from a vulnerable population, you're worried that it may lead to a long condition such as COVID, chronic symptoms and signs, but also you worry whether you're going to survive. And when you worry that you're going to survive or not, that really does undermine what you normally would hold dear. At the same time, if you are so unwell that you end up in hospital, your families may not be able to visit you. If a family member that you care about is unwell and they're in hospital, you can't go and visit them. You can't go and see them in care homes, for example. All of that makes us worry for the effect this has on us, because we can't even hold those close to us dear and close. If we're unlucky enough to end up in ITU, I'm not sure if all of you are aware, but actually that just being in ITU, irrespective of COVID, can actually affect long-term mental health outcomes. Let me give you some examples. You spend a few weeks in ITU as a patient, then around about 40% of people will end up with a diagnosable anxiety condition, about 30% depression, and 20% frank post-traumatic stress disorder. In other words, you don't have to be in an earthquake or a fire to get PTSD. Being in ITU, where you're lapsing in and out of consciousness, people wearing strange gowns, you can't see their faces, strange noises, is profoundly destabilizing to people's mental health. Then I'm going to talk about long COVID. Now, long COVID is something that we are spending much more time in the NHS trying to work on, and NICE has issued some guidance on it. We've separated it into a number of different stages, which is, I suppose, best done through timescale. In other words, the 4 to 12 week period is one stage, and then the above 12 week is a second stage. Many of you will be aware of the physical health consequences, lethargy, for example, loss of balance. But I was wondering whether you're also aware of the fact that it can lead to anxiety and depression, the inability to concentrate, the inability to focus on things such as even reading. And that's a real problem if you work in the health service. It's a real problem if you don't. It's a real problem if you work in the health service. You may struggle to go back to the job that you would ordinarily hold dear, but also you may not be able to do any reasonable job, certainly for the time being. That's, I think, a real problem. That's why you have specialist services now being set up for both the diagnosis of long COVID and also its management, where you have both physical health and mental health services combining their efforts to try and improve that longer term outcome. So what can we do to perhaps help our mental health? Well, the first thing is, whatever we do, make sure that we hold dear those things that perhaps are most precious, but which you cannot put a price on. Family, friends, routines, hobbies. The first thing is, make sure you appreciate what you have. Second, make sure that you do things that recharge your battery. And what I mean by that is things that genuinely make you feel calm or happy or excited. It could be yoga, it could be kickboxing, obviously socially distanced at home only. It could be perhaps making music. It could be singing. It could be anything under the sun. But on purpose, choose something that builds up that battery pack, your internal battery pack, to make you resilient and to keep you calm. Because many of you are going to need that to battle what I call the everyday struggles of being around COVID. Thirdly, make sure you just gently support those around you. You don't have to be a psychiatrist or a psychologist. Asking how people are, checking in on them, making sure that you have Zoom calls which aren't just about business, but also how are you doing? How's your family? What else are you doing? What's your latest recipe? Etc. In other words, even through Zoom and Microsoft Teams and telephone calls, we can still have a little bit of what I call everyday banter. So hold dear and make them precious, those things that are part of everyday life. Second, recharge your battery. And thirdly, gently, just keep an eye out on each other and use every opportunity to see if you can have just a few seconds of what I call everyday chit chat. I hope that was of some use to you. There are many resources out there if you want to go on the web and look them up, everything from Royal Colleges to the NHS to the BMA. All these are ways that we can help each other get through this pandemic, because when we do get through it, It's a tough thing to have gone through, but we will be better doctors, better nurses, better health workers, and perhaps we might even have a better society. Take care, everyone. Bye-bye.
Hi, my name is Jerome Carson. I'm a professor of psychology at the University of Bolton. I'm going to talk today about mental health in the COVID-19 pandemic and offer some personal reflections. On February the 27th, 1958, a plane from the Isle of Man crashed on Winter Hill, just outside Bolton, in a snowstorm. On a memorial plaque near the scene of the accident, the final line reads, "Somewhere around the corner, all is well." Somewhere around the corner, all is well. In March 2020, the UK went into lockdown. For me, as someone who's clinically vulnerable, this meant staying indoors until the restrictions were eased. I never strayed outside my front door. As I never went shopping, I was fortunate to rely on a colleague and her husband to deliver my groceries. During this time, I managed to forget my PIN number. I was not happy, yet previously my research had earned me the name Professor Happiness. Like many of you watching this video, my own mental health began to suffer. Before lockdown, one of my sisters had been diagnosed with stage 4 bowel cancer. She told me, "Don't count the days, make the days count." I did what she said. That period was the most productive writing spell in my whole academic career.
1 in 4 people experience mental health issues each year. 792 million people are affected by mental health issues worldwide. At any given time, 1 in 6 working-age adults have symptoms associated with mental ill health. Mental illness is the second largest source of burden of disease in England. Mental illnesses are more common, long-lasting and impactful than other health conditions. Mental ill health is responsible for 72 million working days lost and costs £34.9 billion each year. Note, different studies will estimate the cost of mental ill health in different ways. Other reputable research estimates this cost to be as high as £74.99 billion. The total cost of mental ill health in England is estimated at £105 billion per year. People with a long-term mental health condition lose their jobs every year at around double the rate of those without a mental health condition. This equates to 300,000 people, the equivalent of the population of Newcastle or Belfast. 75% of mental illness, excluding dementia, starts before age 18. Note, dementia is more accurately described as a progressive neurological disorder, a condition affecting the brain's structure and subsequent function over time, and typically does not occur before the age of 30. Men aged 40 to 49 have the highest suicide rates in the UK. 0.70 to 75% of people with diagnosable mental illness receive no treatment at all.
We have lost over 120,000 lives in the United Kingdom. Many of these victims have died under traumatic circumstances, leaving behind hundreds of thousands of grief-stricken relatives. There are the frontline NHS and social care staff who have been dealing with the direct consequences of the pandemic and having to work in extreme conditions wearing cumbersome personal protective equipment. Millions of our fellow citizens have lost their livelihoods. Many businesses will never reopen. Millions of children have lost out on their education during their formative years. Are the mental health consequences of this pandemic leading us towards a tsunami of mental health problems? Well, a recent newspaper report in The Guardian by famous psychologists said no. In fact, the answer is we don't know. As in so many questions to do with COVID-19, we don't really know. Anxiety thrives on uncertainty. Depression thrives on loss. We have had plenty of uncertainty and loss throughout this pandemic. What can we do? Some years ago, the Foresight Report came up with 5 simple suggestions on how we could maintain our own mental health. The first was called Connect. Speaking to other people and keeping in touch with friends, family, and colleagues is vital. We are predominantly social animals. During periods of social isolation, this means relying on digital technologies such as Zoom, Teams, Skype, or WhatsApp video to see and talk to people. We need to stay connected. The second is learn. As in previous recessions, many people turn to higher education. Universities have been able to deliver their courses online. Many universities are still open, albeit largely virtually. It doesn't matter what age you are, keep learning. Use it or lose it. The internet has opened up the world of knowledge in an amazing way to those of us who have internet connections. Exercise has well-established benefits for our mental well-being. Mens sana in corpore sano, a healthy mind in a healthy body. The fact that gyms and swimming pools have been closed for prolonged periods has deprived millions of people from their usual exercise. Walking is the cheapest form of exercise. Go running if you can. Work out at home if you can't do either of these. The fourth suggestion is give. There are few greater things to do in life than give to others with no expectation of receiving anything in return. Many have helped out with food banks, also with a vaccination program, and in numerous other creative ways. Others give with their donations. This not only helps us, more importantly, it helps the recipients. The final suggestion is take notice. If I look out of my study bedroom, I can see trees. At the moment, there are no leaves on them. Yet, as Shelley said, when winter comes, can spring be far behind? Soon the trees will have leaves. Take notice of the beauty of nature and the inevitable, reassuring regularity of the seasons. This great United Kingdom is blessed with amazingly talented people, from the scientists who discovered the vaccines, to the people who produced them, and to those who are now administering them. Our National Health Service and all the staff in health and social care who've been fighting the COVID-19 pandemic on the front line, many of whom have lost their own lives in this battle, all of whom have witnessed the horrors of what COVID-19 has done to so many people. Then there are the millions of people working in supermarkets, producing and delivering food, to the reliable refuse collectors, staff working in public transport, and our police and emergency services. The COVID-19 pandemic has, in Dickens' words, been the best of times and the worst of times. Hope sustains us. Hope carries us forwards. Remember, somewhere around the corner, all is well. Somewhere around the corner, all is well. Thank you.
Anxiety is a normal experience which we face when we encounter threat, and sometimes anxiety can become quite big and quite difficult to manage. It can also affect our functioning, our relationships, and our work patterns. It can affect our physical health and overall quality of life. There are different ways in which anxiety can manifest. In some people, it is a sense of feeling anxious, feeling nervous all the time, apprehensive, and on edge. We call this generalized anxiety. It's free floating and is present pretty much all the time. In other people, they can experience anxiety in the form of panic attacks, where the anxiety is very sudden and comes in severe bouts. It can also be associated with dry mouth, palpitations, sweating, and other physical symptoms. Those who experience anxiety in the context of a trauma experience can also have flashbacks and nightmares of the trauma, and they can avoid any triggers that might remind them of the particular trauma. It's important to remember that there is effective treatment for anxiety, which is based on evidence as well as clinical experience. And the first step is in reaching out and seeking help. Treatment can be in the form of medication or talking therapy. It's also important, along with medication and therapy or counseling, to look after other things like your diet, your sleep pattern, avoiding drugs and alcohol, and making good social contact. Exercise also helps. It's difficult sometimes to reach out and seek help for anxiety, and that's because depression and anxiety go together, and it can feel a bit hopeless that nothing might change. But once you make the first step, it does get easier. Sometimes it's hard to trust someone, so making that first step and connecting with a professional is really important. It's also important to remember that anxiety or depression, they are not signs of weakness, and there is good treatment available. It's important not to suffer in silence. Feeling sad is a normal human emotion. We all feel sad at times, especially when we are faced with a loss or encounter a loss. Sometimes the sadness can persist and it can affect the way we function, affect our relationships as well as work. Clinical depression is a medical condition where the sadness is persistent, and also people who experience depression can have difficulties in enjoying things and feeling tired quite easily. Depression can also affect our sleep pattern, our appetite, and lead to changes in weight. It can affect cognition, which means our ability to focus, pay attention, and concentrate, as well as memory. We can start to look at things from a negative perspective and also experience some hopelessness and thoughts of suicide. We can begin to withdraw socially and not really enjoy making contact with friends and family. There is effective treatment for depression, and this is based on evidence as well as clinical experience. And the first step is in reaching out and seeking help. Treatment can be in the form of medication or in the form of talking therapy. It is also important to do other things like look after your diet, look after your sleep pattern, avoid drugs and alcohol, and maintain social contact and relationships. It can be hard sometimes for people with depression to seek help, and it's important to remember that depression is not a sign of weakness. The first step is in reaching out and making contact with professionals to seek help. Sometimes the societal stigma or difficulty in accepting depression can also become a barrier. It's important to remember not to suffer in silence. Depression is a medical condition just like any other and has effective treatment which can help with depression.
Hello, I'm Marjorie Hayward, founder and chair of the trustees of a charity called New Friends for You. It's a charity which deals with loneliness. Now, loneliness is a concept you may not have thought of very much, but loneliness is a very important concept when we think of its impact upon health. Loneliness impacts on every aspect of our health and well-being, and when you become lonely, then it's very difficult to get out of the cycle of loneliness. So, what is loneliness? Well, it's a recent phenomenon because in the past we used to live in family groups. Auntie was in the next street, grandmother lived down the road, and so families were much more integrated than they are now. Nowadays, with social movement for work and university opportunities, children of the families move away. And so loneliness becomes more apparent as we get older and our families move further away. But it can occur at any stage in life, and it becomes disabling the longer it goes on. And it does affect both physical and mental health. As a lecturer and a nurse practitioner, I use this image called The Scream. It was by Edward Munch, and it depicts a woman on a bridge in despair, screaming from every corner of her being, screaming from inside herself. That is what loneliness feels like. I've got another image here of a young boy, and he says, "I'm afraid of the darkness. I'm afraid of the silence. Nothing can save me from my own screaming thoughts. I'm afraid of being alone." That gives you a little bit of the impact that loneliness has upon people. And here's another question for you. When does the loneliness end? It doesn't. When we get a cold or a fever, a few days later, with the right treatment, we're feeling better. That's not the case with loneliness. There are no drugs, there are no treatment for loneliness. So if it's such a big impact, how many people are involved? Well, doctors say that they see an average of 5 patients a day, that's every day, whose main reason for visiting them is loneliness. And 4% of doctors say they see 10 patients a day because that person is lonely. One of the people who was referred to my charity, one Christmas Day a few years ago, dialed 111 just to hear another human voice. Fortunately, they referred her to me and we set her up with a weekly visitor. So how many people are involved then? Well, Age UK say that over 1 million pensioners now live alone, and over 14 million are over 60. And by 2031, that is expected to be 20 million people. So if this is such a big thing, what are the dangers of loneliness? Well, many of the researchers have said that it's more dangerous than smoking 15 cigarettes a day. And we all know how we had to give up smoking any cigarettes a day. And they say that the pain of loneliness is akin to physical pain. And a professor at Chicago found that loneliness is twice as bad for our health as obesity is. So loneliness impacts us mentally, physically, socially, emotionally, spiritually. So my message for you today in this health mailer is call your mum, call your dad, call your relative or your neighbour. Don't be put off by them saying things like, oh, I don't want to be a nuisance to you. You're too busy. You've got your own life to live. I'm fine. Don't be put off. Call them. Let them know that they're not socially isolated. You'll make a huge difference to their lives and you'll make a huge difference to their health and well-being. If you can't call them, find a friend who can. Or call me on Friends for You 2016 at outlook.com. Send me an email. Send me your address. Send me their address. And if you've got any spare time and you'd like to become a volunteer for my charity, please drop me a line on Friends for You, all in lowercase, Friends for You 2016 at outlook.com. I'm really looking forward to hearing from you. And for more information, check out our PDF file. It's on loneliness and your health, and it's very informative on looking at the impact of loneliness. So check it out, print it off, and share it among your friends. Thank you for listening.
When to talk to your doctor regarding concern of anxiety or depression. Symptoms that last 2 weeks or more may be an indication you have depression, anxiety, or both. Severe symptoms may include problems with sleep, unexplained emotional changes, sudden loss of interest, feelings of worthlessness or helplessness. If you are not feeling like yourself and want help understanding, make an appointment to see your doctor. It is important to be open and honest so they can fully understand what is happening and get a clear picture of what you've been feeling.
Hello, thanks very much for inviting me to speak on the new ideas for mental health in the United Kingdom. One of the first things that we need to be thinking about is not the definition of mental health, but what it means and what we can achieve with it. Major challenge in terms of social justice for people with mental illness is about determining and learning about capability to be healthy. At one level is the personal capability, and at another,
1 in 4 people experience mental health issues each year. 792 million people are affected by mental health issues worldwide. At any given time, 1 in 6 working-age adults have symptoms associated with mental ill health. Mental illness is the second largest source of burden of disease in England. Mental illnesses are more common, long-lasting and
policy
impactful
level,
than
at
other
national
health
level, what the
conditions.
government needs to
Mental
do.
ill health is responsible for 72 million working days
That
lost and
has to
costs
be
£34.9
integration
billion
in a much
each
more
year.
cohesive way
Note,
between primary
different
care and
studies will
secondary care,
estimate the cost of mental ill health
between
in different ways.
physical
Other
care
reputable
and mental
research
health care,
estimates this
and
cost
between
to be as
healthcare and
high as
social care.
£74.99
And that allows us
billion.
to
The total cost of
develop
mental ill health in
things
England is
in
estimated at
not in
£105
silos,
billion
but in a
per year. People
considered,
with a long-term mental
careful,
health condition lose their
coherent,
jobs every
joined-up
year at
way.
around double the rate of those without a mental
At
health
the second
condition.
level,
This equates to
mental health
300,000
is the
people, the equivalent
organization's
of the population
responsibility,
of
and
Newcastle or
COVID
Belfast.
pandemic has shown us quite clearly
75% of mental
that
illness,
the institutions
excluding
need to
dementia,
look after the
starts
mental
before
health and
age
well-being of their
18.
staff.
Note, dementia is
For a
more
number of
accurately
reasons,
described as a
because
progressive
people in the front
neurological
line have been
disorder,
affected
a
very
condition
badly,
affecting the
people
brain's structure
who
and
have
subsequent
been
function over time, and
working
typically does
behind
not
the
occur
scene
before
have
the
been
age
affected
of
very
30.
badly,
Men
directly
aged
or
40 to
indirectly, and
49
we
have
need
the
to
highest
be
suicide rates in the
looking
UK.
at what their needs
0.70
are,
to
what their support is,
75% of
and
people
how do
with
we provide that.
diagnosable mental illness
And what
receive
that
no
means
treatment
is
at
that
all.
institutions need to have a very well organized mental health and well-being programs to prevent mental illness and to prevent that distress and stress. We know that 3/4 of psychiatric disorders in adulthood start below the age of 24. And therefore, the younger workforce needs to be supported so that because of their stress and distress and pressures, they do not develop psychiatric disorders. At a personal level, I think there are several things that we need to be looking at. I mean, first and foremost, we all need to learn how to look after our own mental health. And that links up with this capability to be healthy. And that is to do with things which provide us with support, which provide us with well-being. And physical health is one. We need to all carry out some physical exercise, physical activity to look after ourselves. It's about good nutrition, it's about good diet, it's about taking time out for ourselves and spend time with people we care for and family and friends, be it through Zoom or face-to-face whenever it becomes possible. What that does also is for us to take on responsibility for primary prevention of mental illness, and public mental health is absolutely vital. And at all levels, we need to give much more support to public mental health agendas. But also, it's worth thinking about, we know that in many ethnic communities, models of mental illness and mental ill health are very different from the majority community. Punjabi women, for example, would talk about, "My heart is sinking," and they would respond when we ask them about depression that this is part of life's ups and downs, so there's nothing that the doctors can do. And then added stigma and discrimination and sense of shame contribute further to lower levels of help seeking. So what we need to be thinking about is NHS needs to go out to where people are. So if Punjabi women are going to the Gurudwara or the temple or the mosque or the church to try and deal with their symptoms of depression, then we need to have community psychiatric nurses and community teams reaching out. In the past, we have done work with Black church leaders in South London, working with them to send the message to the community that there are things that the church can do, there's things that community can do, and there are things that we can do. It's not that they're taking away our responsibilities. We're just educating them to help support them so that they can look after themselves and they can look after others. And there's also very clear in the last few years that lots and lots of people are retiring early or otherwise. So there is a tremendous amount of human capital, and we need to use that capital. And when the first lockdown occurred last year, and there was a call for volunteers, and asking for 250,000 volunteers, it led up to about 750,000. So there is a lot of will and willingness out there to support communities. So we need to learn ways of using that human capital to try and deal with common mental disorders, to deal with stress and to deal with anxiety, to deal with pressures, and help support people who may have serious mental illnesses like schizophrenia and bipolar disorders, but have been discharged in the community. So one of the key messages, again, is not only that we need to go out where people are, we need to find different ways of engaging with the communities. And there are wonderful examples from around the world, and I illustrated the one working with the church leaders. Similarly, there are training programs available for women who may be at home and maybe looking for some volunteering to support teenage moms who may then go on to develop psychosis or postnatal depression or other problems. So I think we need to get out of our comfort zones. NHS needs to be out there working with the community, working with community leaders, working with population at large. Of course, some people will need admission, and there are different parameters and different issues there. But to my mind, public mental health, primary prevention, secondary prevention, tertiary prevention need to be at the heart of the new NHS, which may well come out of this pandemic and the lessons we've learned. We've learned about different ways of assessing patients, seeing them on Zoom, seeing them on other video conferencing materials. But it's also important to engage with the community to create a kind of social contract between medicine and the patients and the public on the one hand, between medicine and the government on the other, and between government and public on the third part of that contract. And it is vital that we all realize that yes, we do have rights, but we also have responsibilities. Thanks very much once again for asking me to join you. I look forward to further discussions in due course. Thank you.
Again, friends, I realize that the current pandemic has exacerbated our capacity to cope with life events. This has resulted into enormous level of situational, emotional disturbances as well as anxiety and depression. Pandemic has brought about enormous changes in our daily lifestyle, and to large extent we are reacting to these changes in our lifestyle. We must remember nothing ever remains constant. Everything is changing all the time. What is today will not be tomorrow. So what is here and now is the right philosophy. So here and now is the most important thing. It is important to remember what we think is what we get. It's almost universal that how you think, the results will be as what you have thought. So in Hindu philosophy also, what you think, you act, and what you act, you get. In English also we say, what you sow, you reap. So it is important that we think positively so that we get positive results. Mulling over the problems will give us more problems. If you stop thinking negatively, then you have got to develop your positive attitude to develop positive thinking. Acceptance of a situation as it is and what it is very helpful. It can develop humility, and humility always helps us to develop the power for positivity. So always try to accept who you are, and whatever condition you are in, accept those situations, and it will help you to motivate to bring the transformational changes in you. So have a strong belief in oneself. Power of acceptance will give you the self-confidence for positive outcome despite the adversaries you might be going through at that particular time. Remember, nothing is constant but is ever changing. So the main ingredients of resilience development are positive thinking, power of acceptance, self-confidence. And how do you go about it? Well, you do not emotionally isolate yourself. Isolation is part of the COVID programming, but do not emotionally isolate yourself. Connect to someone you trust, your family, your friends, or voluntary organizations such as Mind, Samaritans, or local voluntary organizations, or indeed the local masjid, mandir, gurudwaras, or any other churches or any other social organizations. Regular physical exercise, going out and taking a fresh air, going for walks, and do some physical exercises are always helpful to make us physically strong, and it gives all the positive hormones to help you with the positivity. And also, most important thing is mindfulness. Mindfulness, you can Google search and you will get enough tips to go through that, or if you search in local areas, there are number of mindfulness webinars, courses, things are going on. You should join and do some mindfulness. The mindfulness gives you the positive emotional strength. So the most important thing amongst all these is to have a sense of purpose and develop a self-reliance, which will also help you with the preservance of your positive gains. That's enough for the day. Thank you very much. And if there are any questions,
Dance gives us an enhanced sense of well-being. I believe in that, and over the years, going to various places to teach dance, I have seen the evidence of it, that it gives us an enhanced sense of well-being. Not a cure, but a self-realization. It makes one feel, I'm fine, whatever the physical condition is. It is really important, whatever age we are, to keep our body not only in good shape, but also in working condition. If we have a mind energized and stimulated, it helps us to make our body also move. And dance is one thing that can give us both this. Dance stimulates both mind and body. It also connects the body with the mind.
Well, my name is Robin Graham. I am a member of the Rotary Club of Manchester, and my work is based on laughter. Why laughter? What's good about laughter? Well, laughter is natural. It's something we naturally do. It started off possibly as a social response when the hunter-gatherers came back from hunting and they were all alive, and the community would laugh together. So laughter has this benefit of being a social interaction. We can do things like breathing exercises, which help us, maybe mindfulness, to be calm on the inside, but laughter is also a social interaction as well as a breathing exercise. I say laughter is a breathing exercise. Well, let's just have a look at what laughter is. Laughter is a short, In principle, we can laugh ourselves happier, healthier, and less stressed. Maybe we'll try that. Let's pretend to be stressed and laugh ourselves happier and less stressed. Ha ha, ha ha, ha ha, ha ha, ha ha, ha ha. And what about healthier? Well, this is down to the physiology of laughing. Research has been done since 1970s. We know, for example, laughter takes us from fight or flight to relaxed. Fight or flight, in principle, means our energy is in our limbs, ready to fight or run away. And where's the energy to keep our body healthy? But if we come into the relaxed state, then the energy is there to make our body healthy. Secondly, instead of cortisol, the stress hormone, being the one which is acting on us, when we are in the relaxed state, we release happy hormones, serotonin, dopamine, oxytocin, endorphins. And because of that, we're happier. And because the energy is in the body, we're healthier. So laughter does this magic for us. But laughter also is a social glue. It's very often part of social interactions. So it may help with things like anxiety.
Coronavirus and the lockdown has made everything so much harder, you know, accessing mental health services or just seeing your friends and family when normally they would be a massive support.
There's a lot of people who are calling because they're lonely, because they don't have anyone that they live with and they're not seeing anybody. And I think it's just been important to show them that they're not on their own.
You in your Samaritan role might be the only person that that caller has spoken to all day.
The fact that we were there during that moment of loneliness and isolation, I think it was a beacon of hope.
It was quite apparent from a lot of the people I spoke to that we were almost like a last port of call.
In a time of uncertainty, the only certainty that the callers have had is the fact that our service is consistent and constant.
Being available to callers 24 hours a day is really important.
The reality is there are very few people that you can ring in the middle of the night.
It's a very simple thing we're offering, but I feel it has a dramatic influence on their anxiety levels at that point in time.
The support we have given to key workers, I think that has been a privilege, at least for me.
I've actually found it a bit of a lifeline for myself.
Yes.
Coming into it because I live on my own.
I've been self-isolating and it's really kept me going and being still connected to the branch.
The branch is a community. It's a very, very, very important community to me.
I've been off work and I was off uni, and it gave me kind of a purpose.
All of these branches are connected and speaking to each other to ensure that between us this service is available.
We're all strangers, but we all share this one wonderful thing.
I guess anyone can be a bit of a Samaritan in their own life. You can listen without judgment, you can really ask how someone's feeling, and you don't have to be an expert to do that. You just have to be a listening ear.
My life has been pretty fantastic, really, up to about 10 years ago when we suffered a suicide in the family. This was by far the most devastating thing for everybody. I think the only way that I can describe it is probably like a shockwave. It just keeps disseminating outwards and just affecting everything in its path. Being a man the way I am, I found absolutely no reason to share it with anybody or talk to anybody about this. I could bottle it out and geezer it up a bit and get on with it, you know, and if I couldn't, well, I'd go down the off licence and get a couple of bottles and that would sort of sort it out for a little while. I think you can get to the stage, especially males, where you have just let this go on and on within you. And I do think that there becomes a point where everything becomes so dark and so black that there is no other way that you've got. And I think it's so important that you recognise those signs earlier on, and it can be just an hour's conversation, a half an hour's conversation. And it could only be once, but it could just be that tiny thing that could just make you think, okay, I feel so much better about that.
Hi, I'm Professor Subodh Dave. I'm a consultant psychiatrist in Derbyshire, and I've been recently elected as the Dean of the Royal College of Psychiatrists. Firstly, thank you very much, Russell and Professor Ramesh Gupta, for inviting me to address the National Forum for Health and Wellbeing. I think you're doing a great job in getting involved with the community directly, and that is one area that I'm really passionate, having been working as a community psychiatrist for many years. I think that there can't be any community care without genuine community involvement, so the work you're doing is very laudable. Thank you. Last year has been quite an incredible year by any stretch of imagination. We use the word unprecedented quite loosely sometimes, but this genuinely has been an unprecedented year. COVID has had such a devastating impact on the lives of many people. I've lost colleagues, and it has been a year of grief and sorrow for many, and toil for many. And the impact of not just the COVID illness, which I know has impacted on many people. We've seen that apart from the physical morbidity that you see with COVID, and indeed the risk of mortality, there has been a huge psychological impact of COVID, the illness directly. I think we've seen illnesses like anxiety, depression, even insomnia and post-traumatic stress disorder, delirium, a whole lot of host of illnesses that have come in the wake of having had COVID infection. And there's no us and them with this illness. We've seen a large spike in mental illness secondary to COVID in healthcare workers, and so my colleagues have not been immune to this, and indeed the wider population has had to bear the impact not just of COVID but also the impact of life. And so it's been a learning curve for all of us, and as the vaccination program rolls out, and I hope that everyone is taking part in getting the vaccine and encouraging others to take the vaccine. I've had mine, the first dose. I'm waiting for my second dose, and I encourage you all to do the same. But I think it's important that we don't forget that this illness has had both a physical impact as well as a psychological impact. And as a psychiatrist, I'm particularly keen to remind people that the NHS is there for us all, not just for our physical health needs, but also for our mental health needs. So if you are experiencing any signs or symptoms that are affecting your health and well-being, please get in touch with your GP, or indeed with the NHS we have 111, so that's available 24/7, 24 hours a day, 365 days a year. And of course there are other charities like Samaritans who are available on 116-123. That's 116-123. So please note these numbers down, be aware that help is always available, and let's be loving and kind to each other. I think we need this more than any other time, and together I'm sure that we will vanquish this illness that has had such a devastating impact on all of us. Thank you once again, and good luck with your future endeavors. I hope to see you all in person at some point.